Firefighters put their lives at risk to protect you. The smoke, the flames, or a collapsing building sometimes cost them their own lives. Asphyxiation, trauma, and other aspects of the life-saving, risk-taking job come to mind. But according to the CDC, nearly half of the firefighter deaths are happening because of heart attacks.
Well, Jamie, for the Baltimore County Fire Department, it's a story that hits close to home. They're taking part in a study done by a group of doctors at Johns Hopkins to cut down on the risks and make a change. It's no job for the weary, but it's not necessarily just the risk of the job that's taking so many lives.
It's one of my first memories of being in the fire department, standing at attention while the procession went by.
One of Chief John Homan's earliest memories on the job, a memorial ceremony for a firefighter fallen victim to a heart attack. Now, years later, another in his own department.
When something like this happened, everybody's looking for answers, and everybody's going, why?
In May, 58-year-old Robert Fogel, a Baltimore County firefighter, went into cardiac arrest during a training exercise and died. Outside
of his family, there was nothing more he was proud of than his profession, and it showed in his career here at Baltimore County as a volunteer out in Pleasant Valley and as an instructor for the University of Maryland. You know, this was his life. According to the U.S. Fire Administration, nearly half of firefighter deaths are happening because of heart attacks.
When you think of 48% of those firefighters could have gone home at the end of a tour, yeah, that's a huge number.
Victor Stagnaro works with fire programs for the National Fallen Firefighters Foundation, a foundation that's funded several studies taking a look at why so many firefighters are falling into this statistic.
What are we missing? What detection components are there? How can we find things earlier? And there's just so much we don't know.
According to a study done by a group of doctors at Johns Hopkins University, cardiovascular events account for 45% of deaths in on-duty firefighters.
I think it's shocking. It's a very high number.
Compare that to the 15% of all deaths on conventional jobs.
It dawned on me, I really didn't know why firefighters had such a high risk of heart disease, and most people don't know.
Dominique Ashen works in preventive cardiology at Johns Hopkins. She's worked with both the Baltimore and Howard County Fire Departments in a recent study, taking a look at cardiovascular risk factors, checking the typical physical exams, but taking it one step further, looking into blood work and doing scans of their hearts.
As I always tell the firefighters, when you look inside to actually see plaque, either here and or here, we found quite a number of them that were then designated as high risk.
High risk, she says, without even knowing it. And now the lines are blurred when it comes to age. Heart attacks in the fire department are happening younger and younger.
That morning, for whatever reason, he came back in before he left the house and he said, I guess I ought to eat some breakfast with you. And that was it. The last time I talked to my son.
23-year-old Andrew Waybright collapsed during training in 2002.
Some days it was 15 minutes ago.
An autopsy report shows the Frederick County recruit died from hyperthermia. Like Fogel, he's one of nearly 11% of on-duty deaths that happened during training.
The thing that probably sticks most in my mind is that he said, they told me not to worry, that they would know if we're in trouble before we did.
Now a memorial stands in his name, centered in front of the lake where it happened.
To me, the memorial is there to, you know, show people that it did happen. It happens here. It happens to somebody we know. And that, you know, we don't want this to happen again.
Frederick County says they've made changes since the deadly 2002 incident.
Anytime a firefighter dies, all of us around the region, around the country, we try to pay attention to it. And again, what we want to do is learn from these deaths so that we don't repeat what happened.
During training, they now monitor outside conditions, make sure recruits are always hydrating, and use radios for communication. Changes that came out of Waybright's line of duty death results and discussions. It will be months before those results in Fogel's case will be revealed. Results that Chief Homan says will tell the story of what exactly happened.
If there is any good that would come from a tragedy like this, I would think that some people said, this is my signal to get with the program and to get my physical done and to get the testing done and the blood work done.
It's a push for firefighters to get checked and a push for researchers to find out what's behind such telling statistics.
We vow as a foundation and as a fire service that we will never forget. However, for those survivors, those family members, they don't have a choice. They will never forget.
The National Fallen Firefighters Foundation funded the Johns Hopkins study along with several others. In 2004, they focused on preventative measures to cut down on line-of-duty deaths, and they came up with 16 firefighter safety initiatives. One of those initiatives deals specifically with fitness and heart-related matters.
Man, to the chief with all the, and also that dad, 23 years old.
I know,
man.
so sad.
So with this fitness initiative, is it working? Are we seeing results right now?
Well, Chief Holman says one of the biggest things that they struggle with is this resistance from the firefighters to actually get checked. Just this past year, Baltimore County developed a standard operating procedure that requires all employees to get a physical. But he says some firefighters are so dedicated to their job that they're worried a physical could reveal something that takes them out of their line of work. Everyone agrees that the issue of heart-related illness and firefighters needs to be attacked at all angles. That's physical fitness, eating right, and checking out health conditions regularly.
All right, Amy, well, you know what? They may be reluctant to follow the fitness initiatives, but what about the firehouse safety precautions? Our In Focus digital investigators looked into safety violations at fire stations. They are rare, but they do happen. Things like not wearing seatbelts and not properly cleaning respirators. And also for firefighters are some of the violations reported from firehouses here in Maryland. So see what our digital investigators dug up on our website. You can find the story at abc2news.com/infocus.